Okay, well, thanks everybody. Welcome once again to our first annual Coloradans Month, our version of Older Americans Month, which happens every May, and every May there's a theme, and this year the theme is Communities of Strength. So this is our third and final presentation in this series. Our team, composed of Colorado Senior Lobby, Colorado Center for Aging, Changing the Narrative, AARP Colorado, Lifelong Colorado, and Dr. Cog, is exploring with you the common interests and strengths of all Coloradans, in particular, the 2 million of us over the age of 50. Speaking for myself, age 50 faded into the rear view some time ago, but oh well. The primary purpose of this 3-webinar series is to inform and encourage each of you to engage with us, to raise our voices, and to be really heard with our policymakers at every level of government to create new communities of strength. In today's session, we'll hear from people around the state about what they are doing on the subject of aging in their communities. We will also present our first annual Public Service Awards to acknowledge a few folks within state government who have shown leadership in working to improve the lives of older Coloradans. You may have seen the revolving PowerPoint with our sponsors, and we thank each of them for their support. Relay Colorado, InnovAge, Colorado University's Multidisciplinary Center on Aging, and Primetime News. I will now hand you off once again to Jody Waterhouse, CSL, and CCA board member and active volunteer, who also has a very busy day job at CU Anschutz, promoting better aging there and across the CU campus complexes. Take it away, Jody.
Thanks so much, Bob, and thank you to all of you for being with us for our final session, webinar session during Older Coloradans Month. The sessions have been terrific. We launched with our first webinar 2 weeks ago, really diving deep into ageism and ageism in the workforce, ageism in healthcare. Had a very robust discussion about that, which then took us to last week's discussion, talking about age-friendly communities across the state, and for communities that are interested in becoming age-friendly communities, how best to do that. We're gonna kind of roll that all into one today for the culmination webinar of this terrific month in celebrating older Coloradans, to really get a perspective of what is happening across the state from key representatives from those geographical areas that can give us some insight about what is working and hopefully some insight about what isn't, and what do we as a state need to work on, and as certainly as leaders in the aging sector need to focus on for the coming years. So a huge thank you to all of our panelists today for being with us and sharing some insight about the work that they're all doing in their communities. Now, this is very much a dialogue between our panelists and the Zoom audience. I have some posed questions, but please use the chat room, put your questions there, and then we will make sure that the panelists address those. Today's format for the panel presentation is slightly different in that we have pre-recorded 4 sessions or panel presentations, and we're going to see those first. We then have 3 panelists who are with us in person, who also are going to present, give us some overview of just what's going on in their communities, and then invite all the panelists, the ones that participated in the recorded sessions, as well as the ones here in person with us, to then dialogue with all of you. So that's going to be the format for about the next hour and 15 minutes or so, and then following the panel presentation, as Bob mentioned, we will move right into the awards ceremony. So with that, I would like to first introduce the 4 panelists who pre-recorded the sessions for you. And then what I'll do after we watch those is introduce our 3 panelists who are going to present to you in person today. So the first recording, Sue Ballou is board president, of the Partnership for Age-Friendly Communities, representing Larimer County. Unfortunately, Sue couldn't be with us today. However, Lori McLeod, who is the executive director of the Partnership for Age-Friendly Communities will be here as one of our panelists. The second is John Rodwick from Fruita. He is a former dean in higher education. He's a psychologist. He's a chair on the Livability Communities Commission for the city of Fruita. He's an AARP volunteer and formerly the county chair for Area Agency on Aging. Welcome, John. And Bob Kirkpatrick is a retiree, very concerned about aging issues in his community. He was a regional vice president for 33 years for the American Heart Association, dealing with managing large groups of employees and training them to generate income to support American Heart Association. Very, very important. We love that organization. After he retired, he didn't really retire. He started his second career as a fundraiser, of which he did fundraising for nearly 10 years for the Pima County on Aging in Tucson. And then 6 years ago, relocated to this wonderful state and represents Colorado Springs today, where he was asked to be vice chairman of a new commission being formed in the city of Colorado Springs. So thank you so much, Bob, for being here. Great to have you. And then finally, Eden Bailey, who is with the city of Boulder. So we'll be representing Boulder County today. And she is the adult services manager there at that office. So with that, Bob Brocker, we have a lot of Bobs on today. If you don't mind queuing up the videos, and we'll watch those, and then we'll come back for a little more discussion.
I'm Sue Ballou, and I'm president of the board of the Partnership for Age-Friendly Communities in Larimer County. I'm also co-chair of the Housing Priority Group, so that's kind of my main interest, but I'm involved in all the aspects of the organization. Certainly, we have a very active senior center. We have large groups of volunteers who do work as docents at museums and other events and other things like that. In the partnership, we engage people on a number of different levels. The board and the steering committee and all of the priority groups have significant numbers of older adults in them, as well as younger people who are working in the areas that we're exploring. We also have this wonderful thing that we do, which is called self-directed volunteer teams. So when we have a problem that needs to be solved, we pull together a group of mostly older adults who have the time and skills to solve that problem. And so it's a short-term volunteer opportunity. You really get to contribute to solving a specific problem, and you're not signing up for the rest of your life. One of the things we developed was we wanted to bring a home share program to Larimer County. And so we formed a self-directed volunteer team that researched what was happening in the rest of the country and the rest of the world, what was working, what wasn't. We also try to incubate programs and not own them so that we can move on in developing new programs. So we then researched and worked with other nonprofits in the community to find someone who would house that. And Neighbor to Neighbor, which is a housing group in the community, houses that. It's on hold during COVID, but it'll be back soon, we hope. And it's an exciting program that we developed for Larimer County. Everything we do is a collective effort. Another program that we started was Senior Access Points, which is a single entry point to learn about resources within Larimer County. And that's actually being taken over by Extension and is being spread throughout the state. But it started by people saying, nobody really knows exactly where to go, how to find the resources we need. And so, again, it was a self-directed volunteer team that came together to figure out how to make that happen and work with partners within the community to make that happen. One of the other programs that the Partnership for Age-Friendly Communities started is an Intergenerational Conversations. And so we have facilitated conversations working in concert with the Center for Public Deliberation at Colorado State University. And they pick a topic, and it's high school students and older adults talking in groups of 5 to 8 around a table about a topic. And it's been really wonderful because some of the things that address high school students also address older adults. Social isolation, a feeling of loneliness. And people learn from each other. It's been a very exciting project. Colorado AARP has asked us at a number of conferences and in one-on-one conversations to share our model, particularly of the self-directed volunteer teams and the collaborative nature of convening people throughout the county to solve a problem. So we are sharing it with other communities to the extent that we can. Capacity is always an issue. The thing I think that's important in Larimer County and probably in most communities is there's no dearth of services. We have a lot of great services and people who are really doing wonderful work in the area of aging. But sometimes there are gaps, there's overlap that doesn't need to be overlap. And so it's really important to bring everybody to the table and figure out what the next step is. We're not trying to be the solution. We're trying to bring together the people who have the solutions. And I think we're very successful at that. We find an issue and find who else is working on that issue and how we can work together rather than duplicating a lot of efforts.
We're fortunate in Colorado Springs to have a city council support and of having an age-friendly city. And I think that's really important. And they can address the many legislative and budget issues and plus the valuable leadership of various community organizations like the YMCA, the Area Agency on Aging, and there's a Council on Neighbors and organization. Oh, and Silver Key is that's a grassroots organization that provides a variety of forms of transportation for individuals in Northern Rocky Mountain PACE, provides medical and wellness programs, respite care, and home delivery meals and so forth based on income. We're having a lot of growth in Colorado Springs. It's in the outskirts of the city, and there's limited transportation facilities. There's limited ways for older adults to involve themselves in in activities, social activities, and other events, and very minimal intergenerational interactions. So we still have a long way to go. Are we a model? Maybe, but we have a way to go yet. We do have a lot of opportunities for seniors to get involved, especially on boards and even small things that are still important. Working with the Humane Society, walking the dog, working on hiking trails, cleaning up roads, serving on local elections. And I think those are all important, but we don't have a centralized volunteer center to help people find exactly where they can find an opportunity to work. And I think we need to do that also. Well, I want to go back to 2015 when Colorado Springs, they committed to pursuing an age-friendly city designation through AARP. And work began with the city, and another committee was formed called Aging Collaborative. It resulted in a strategic plan for aging for the city. And that plan's going to be very important to us for now and for the future, I think. It's an interesting factor to come out of, many things came out of the plan, but, the millennials, for example, have said, just as well as older adults, that they both want to grow up and grow old in Colorado Springs. They want to live in a city that has great outdoor spaces and quality health care and good transportation and housing that fits their lifestyles. And that was important, but they really made a plan to help us. We could have some excellent senior community centers and complexes in our community, but they're awful expensive for older adults that are in, especially on a fixed income. It's really hard, for a person to be able to afford, $4,000 or $5,000 a month to go to one of these beautiful senior complexes. And so the plan through interviews also found out that what people really wanted to do was to stay independent and stay in their home as long as they could. And they just had a deep desire to maintain that independence. And I know we're discussing local communities, but one thing we can't ignore is the prohibited high cost of long-term care insurance. Someday, maybe the federal government might come out and consider making it part of the Medicare plan, but to provide home care for older adults and remain independent and be with their loved ones, and rather than in a senior community or a nursing home. Colorado Springs it's the second largest city in Colorado, and we anticipate a lot more older adults in the future. Right now, we have about 50,000 people that are over 65 years old, and it's not going to be too many years from now that we're going to have many more. And so we really have to address aging in our society.
For many people who are not familiar with the Western Slope, Fruita is just 12 miles from the Utah border and about 5 to 6 miles away from Grand Junction. Because we are a valley community, which includes Fruita, Grand Junction, and Palisade, we have a lot of resources available, and a lot of activities go on with regard to the senior population, primarily because a lot of retirees choose to live in the valley because the weather is temperate and the medical services are really outstanding. We have 3 hospitals in this valley, and beside all the retail stores and other services through Mesa County, we are really in an optimal location. Well, one of the biggest examples at this point was the building of the Fruita Community Center, in which a group of seniors spent almost 10 years collecting beer cans, soda cans, and whatever, and were able to make a donation of close to $100,000 toward that effort almost 10 years ago. And as a result, we actually have a senior center within the community center. This has been a real boon for the community because the seniors are also able to have their lunch meals provided by Meals on Wheels. And it gives them an opportunity to socialize and to have a variety of programs that serve their needs. Jackie Foster is a remarkable individual who engages continuously with seniors. Even during the pandemic, she sponsored weekly senior hikes and continues to do so, both twice a week. One is an easy walk and the other is a more strenuous hike. But she does that for the 50+ population. The city also created a livability commission. And I serve as chair of that commission, in which we are taking a look at 5 dimensions of livable communities. And the Livable Community Project was authorized and designated by AARP as one of their 500+ communities in the United States. The commission is composed of all ages, ranging from high school to college, to business people, to professionals, and to retired individuals. In addition to that, we also sent in applications for community challenge grants through AARP. And this too was a benefit. We will find out very shortly what the outcome of the application is, but we are looking at ways of improving safety within our community, both at the transportation level. We're trying to improve overall communications and also make sure that seniors are very much aware of the vaccination program for COVID, as well as other health opportunities that will keep them healthy and active within our community. And what's very interesting that AARP has a membership of well over 85,000 on the Western Slope. So we're well represented. Within Colorado, it exceeds over 280,000. The largest lobby in the United States. And we are making our case to the Congress and anyone else who is willing to listen on issues related to on senior issues, whether or not it happens to do with education or nursing homes or healthcare, Social Security, Medicare, and the whole Livable Community Project. We are trying to attract Grand Junction, Delta, Montrose, Rifle, and Meeker and other rural communities. I think we have a very robust senior community, very well educated. We contribute to the community as much as we possibly can, to other organizations, to a variety of organizations, and we are able to serve on city commissions as needed in order to give input and make our community a better place to live. So thank you very much.
We went from a senior center and senior services to older adult services and an age well center. And the focus is very much aging well. And that is part of the changing the narrative of ageism. And so we look to other people in our community or nationwide who are experts on this, where we can learn and where we can put those pieces around racial equity and ageism and the intersection of those two into our initiatives and our programs and our planning. We've heard this sentence before, that a livable community is as comfortable for an 80-year-old as an 8-year-old. And we really do want to make sure that that is true for us. We really believe that older adults and future older adults deserve a livable community. Another initiative that we're part of is a countywide coalition called the Elder Justice Coalition. And that is comprised of county and municipal governments and nonprofit organizations that provide human services, primarily to older adults. Recently, the Elder Justice Coalition received a grant from the Department of Justice, the Office on the Violence Against Women. And this grant is primarily designed for training and education for first responders, judges, prosecutors, and service providers to raise awareness and work towards ending elder abuse. And as we know, with the aging population, we'll have more and more older adults. This is going to become more of an issue. And so it's a multi-year grant. And we are also looking to our service providers and older adults to give input on this grant on how we're going forward. And I think any community that is interested in addressing elder abuse can look at some of the grants that are out there to help raise awareness and do some training so that people are aware of all the implications of abuse for adults in later life. And we do have a volunteer program with older adult services that I would like to see grow. And I've looked at other communities, and I think I'd like to combine a little bit of pieces of different communities. What we have right now is called BPOP, which stands for Bill Payer and Organizing Program. And so we have volunteers that are supervised by one of our case managers, and their background screened and trained. And they help older adults get organized with paperwork and details and bill paying. And what we never want to see is an older adult getting a notice that a utility is going to be turned off, or that their landlord wants to know where the rent is because of an organizational issue. We don't want those things to fall through the cracks. And so that's primarily what this program does. And it's also, the pandemic has really drawn attention to the digital divide. And as we see more and more companies, especially credit card companies, doctors' offices, utility companies going paperless, the need to connect to some, even to access your bill, let alone pay your bill, requires a certain amount of connectivity. So one of the things we did mid 2020 is we had some coronavirus relief fund dollars, and we used that to buy Chromebooks, iPads, and hotspots, and put those out in the community in the hands of older adults. We partnered with some other agencies for how to set this up and ongoing tech support. And so that's going to be helpful with our BPOP program. But also what I'd like to see that do is grow and turn more into a combination of a greater volunteer tech support, where there's not just peer mentors, but also bring in some intergenerational mentors. We did have a couple of ongoing tech classes and had high school students as the mentors, and those relationships developed. They were great. Both sides of the equation had value to it and benefited. And so we'd like to see our bill payer and organizing program. It's been obviously a little quiet during the pandemic, but as we ramp back up, we expect to see that really start up, and we'd like to see that grow and develop. Community living is creating a safe and secure environment where people feel able to engage both socially and civically. We think older adults have a lot to offer, and we want to make sure that our community really allows them to feel safe and access to those kind of things. And we are still in the recommendation process, and we're working through those, and we're about to then take our internal recommendations to some of our community stakeholders. And then we'll start that process of submitting to DRCOG, who will then submit to the state. And hopefully by the end of the year, the city of Boulder will be a lifelong Colorado city.
Thank you so much to our panelists who took time out of their busy schedules to pre-record that. They each gave us wonderful examples of programs, projects, initiatives that are happening in their communities. So I hope that spurs a little bit of thinking on your behalf. And while you're doing that thinking, put into the chat room if you want any of them to dive deeper into how maybe a particular program, project, or initiative got set up. The purpose today is to learn from each other and take back to our communities to just try and build, age-friendly communities across the state. So be thinking of that while we move into now our next three panelist discussions, and then we'll open it wide for question and answer. So it is my privilege now to introduce our next three speakers who are here with us. They are, and I'm again going to just read a little bit about their bios, and then I'll have each of them present, and then we'll move into questions. So first of all, Lyle Smith-Graybill is VP of Community Development at the United Way in Weld County. His portfolio includes communications, foundation and large designated gift fundraising, and the Connecting Weld initiative. Hopefully we'll learn more about that in his presentation, which includes people connecting to services and nonprofits by increasing their capacity. So thank you, Lyle, for being here. Next is Janet, also from Weld County. Janet Bedingfield is the Executive Director of 60 Plus Ride. Janet's role is varied, as we all wear many different hats in our role, and her role includes management, human resources, communications, marketing and publicity, outreach, finance, and she also wears a fundraising and development hat like Lyle, and an advocacy hat. So thank you, Janet, very much for being here as well. And our third panelist is going to be Veronica Mays, and she is the Area Agency on Aging Director for Region 14, covering how do you say that? Huerfano? Oh, I'm showing my Southern California and Las Animas counties. And Veronica, you can help me with that when you get on. Under the agency of South Central Council of Government. Her role and responsibility in that particular area of the state is to manage the senior program, advocate for seniors, and address the needs of communities, a community for the seniors in her community. Here's a fun fact, which I don't know that you all know. Her region has the state's highest percentage of senior population over the age of 60, although they are the smallest AAA in the state. So we'll have Veronica talk a little bit more about that as well. So Lyle and Janet, I'm gonna bring you up first so you can share with us a little bit of what's going on in Weld County.
Sure. Would you like us just to jump in, or would you rather ask us questions? Okay.
Oh, Janet, please, if you don't mind sharing with us a little bit, and then Lyle can go next, and that would be terrific.
Wonderful. Thank you. Well, I wanted to start by saying that volunteerism in Weld County has a long and robust history. It's just the culture here. And so as a part of that, we have a really vibrant group or culture of 60 and older volunteers. And I see that in almost everybody I know who's capable. For example, Meals on Wheels, I know a lot of their board and volunteers. My own, and to give you some background, what we do is we offer transportation to Weld County residents 60 or older, regardless of income. And as most of you know, or you might be slightly aware, that's 4,017 square miles. So there's a lot of variety in that. But I have a friend who's on very, very involved in water. We have a AAA advisory board that's, I'm not even exactly sure, 20 probably people in this demographic. I'm thinking of our CDBG board has at least half of them are in this demographic. So it's just the Stampede, if you've heard of the Greeley Independent Stampede, that is run by a variety of ages, but what's behind the scenes is something called the Wranglers, and they do the actual boots on the ground work, and that's a 300 plus strong group, and I would guess that at least a third of them are in that age group, as well as some of the committee members. I think of my own dad as he's 96 going on 97 now, and until about 3 years ago he was heavily involved in hospice, on the board with clients, all different varieties of involvement. But that's just and I'm sure it's everywhere, but it's just not unusual. We see a lot in the Carbon Valley, which is South County, which is Frederick, Firestone, and Dacono, and they have something called a help center that was brought together solely by residents 60 and older. We have something that Lyle and I are both heavily involved in. And I probably will go into that a little bit. But we have two people, and probably the person who's driving it the most, this collective impact group, is Jim Reesberg, who is himself in the demographic, although certainly not typical. He's very, very, has been involved for years, has been a state representative, was director of insurance for the state, et cetera. And then another gentleman by the name of Ron Heil. So I thought it'd be fun to give you a little bit of history and how we came to where we are. I actually, I guess could say I was the igniter, but it's been such a group effort that my part was so small in the big picture. But I came from working with children and cancer, essentially, in my background. I'd been a classroom teacher and done a lot of volunteerism in both of those areas. And when I started this position about 5.5 years ago, I felt like I'd walked into a brick wall, honestly. I'd ask for money and people would say, well, you know, we give our money to kids in education. Well, I certainly couldn't argue with that. I'd seen the need. But I also asked to speak with 4 leaders in the community, one of whom was Lyle, and one of whom was Eva Jewell, who is the past AAA director here, and then the Community Foundation and Catholic Charities, because they are both heavily involved. And eventually, having had lunch with Lyle, and Lyle said, well, you know, AAA really needs to drive that. And me being the newbie, I then met with Eva, and she said, well, you know, United Way really needs to come on board. And so me being, again, being the newbie, I said, hey, Lyle, Eva, how about going to lunch? And I just was really persistent, because coming from another culture, I came in and saw that, as others have said, there was so much good work being done, but I didn't see it being leveraged for voice. I didn't see it. I saw this lack of public awareness. There certainly wasn't a lack of need. There certainly wasn't a lack of services, but there was a huge lack of public awareness and funding, as Rand Morgan, who is the CEO of our Weld Community Foundation, said, you know, there's even more money for the arts than there are for older adults, he said, and that's a sad thing. And so what I did was I started gathering these people, and it was like herding cats for all of us, because our schedules are so busy. These are the leaders. And it took about 18 months, and we started meeting monthly. And then in the middle of all that, we invited Janine Truswell, who is I think her title is CEO, sorry, Lyle, of United Way, who's just a wonderful, dynamic woman, to come talk to us about, you know, how can we partner with United Way? And my impression, the look on her face was, it's really worthy, but, you know, without saying words, I just don't see it happening. Well, lo and behold, United Way was switching from community impact to collective impact, which is a different funding structure. And so this small group of 6 on our task force that we had pulled together sent a collective email asking them to consider us as one of their, we didn't know, 3 to 5 is what I think it was, collective impact groups, which means they would focus on them. And in this group, in this meeting with Janine Truswell, there was another gal named Melanie Falvo, and Lyle was always there too. And I saw the lights go off in her eyes when I said, well, it's not really about the funding for us. It's about getting the publicity, it's about making people aware of the needs. And so then came the email, and the date passed, and we were all kind of like, well, you know, okay, Janine kind of told us. And then all of a sudden we heard that we were designated as one of the 4 collective impact groups. And from there, as I've said before, it kind of feels like the wagon wheel was stuck in the mud and it broke loose. And now it's more than broken loose. I feel like it's really starting to roll. And so that's how we got where we are. And it's been a very collective, I think Lyle would probably have the exact numbers, because collective impact is now housed, and I'll let him take over within United Way. And our task force was assimilated into that, because that's what we were after, was a collaboration. But I think there are at least 40 agencies represented on that group. Lyle, maybe you can take it from there.
Sure. At any given, over the course of the years that we've been together as the Aging Well Collective Impact Work Group, we've had about 40 different organizations that have engaged on a regular basis. We have around 20 that meet monthly to discuss where we're headed as a group. As Janet mentioned, our United Way did want to move from a more competitive process for how funds are distributed to a more collaborative process for how funds are distributed. And that's really what led to what we now call the Aging Well Collective Impact Work Group. So I think that's just, you know, that's been a really valuable mechanism for a couple things. And one is the groups that are working with older adults and older adults themselves that are in the group. Janet mentioned a couple days ago, you know, it's kind of an aha for me, is a number of the older adults, or a number of people in the group that work for organizations that work with older adults are also older adults, you know, in the 60+ age range. So that's been valuable, the connectedness, because what it's done is helped the group of organizations and advocates that meet each month to think about higher level goals. We are all focused on what our organizations do, which is really important because we want that to be done well and to continue to provide that community capacity. And then at the same time, how do we think about the goals that we're all trying to achieve together? And for certain, those that have been through the AARP age-friendly network process and that planning process are thinking about those higher level goals. And then also we all have the CASOA, the Community Assessment Survey for Older Adults that our AAAs do every 4 or so years. And that also gives us kind of a high level picture of how the community is doing on these key indicators. But we don't always, kind of come together to think about how do we achieve those goals or make those our goals and achieve an increase in the livability of our communities unless we, really make that an intentional effort. And then the second thing has been just for capacity building. One of the things that the Aging Group decided was a need is just more volunteers generally for working with the organizations that serve older adults. And so we decided as a group with United Way as the applicant to apply to Next 50 initiative for, at the time, what we were just calling a volunteer recruitment coordinator. And Next 50, thankfully, thank you Next 50, approved our application for 2 years for hiring an employee at United Way whose sole role is to increase the number of volunteers for working with older adult serving organizations. And we're still in our first year of this, and it's been complicated by COVID, of course. But I think that, Janet and the other organizations that are part of Aging Well would all feel like this is a great capacity increase for our community, just because it gives us the opportunity to recruit more older adults to work with, or recruit volunteers to work with older adults. So those are some outcomes, I think, of this kind of higher level coordination and the interaction between groups that is improving the quality of life, as AARP talks about, not just for older adults in Well County, but for everyone.
Oh, thank you, Lyle and Janet. That's terrific. And giving us kind of a different perspective of, building key stakeholder groups, which is always a challenge for folks. So, and the fundraising piece, we're going to come back a little bit to that. So thanks for introducing us to that. Now, Veronica, we're going to take a little trip now down south to Veronica, who is in Trinidad, I believe, and she's going to share with us what's going on in Southeast Colorado. Veronica.
Thank you for including our little end of the I-25 corridor. I am actually in Wolsenberg, which is north of Trinidad, but I do cover Huerfano County and Las Animas County. And we are big in area, small in people, but definitely have a huge percentage of our population over the age of 60. We are edging toward 40% of our population over the age of 60. So that means that our workers are older, our people, everybody's there. And when I came into this role in 2015, we basically have the basics of AAA, which is meals, which is transportation, and a lot of in-home care. A lot of those services are being provided by our agency. So our agency basically developed around the AAA, like what we needed for this area. And this was done way before my time. And, that's how our agency has grown. We've grown to adjust to AAA, which we've expanded to other areas. With that means we don't have all these other partners that everybody else talks about. We don't have United Way here. We don't have AARP here. We don't have all these others. So we really kind of are on our own with local governments, local healthcare agencies, and we do a really good job for the small areas that we have. And because we are the smallest of 16 regions, we get the smallest in funding. So we're trying to reach out to these people. I still have people today tell me, is this new? It's like, no, AAA's been around for a long time. So it's been a lot of educating myself on what AAA is even capable of doing and bringing in those partners. And through COVID, I will honestly say I have gained more partners in this than ever before. The counties are listening, the municipalities are listening. So it's amazing, the positive part of what COVID did. So now we're really just trying to get people through this make sure they get fed. Food insecurity was a really big issue before and during COVID even more so. So kind of like, you know, in small areas, a lot of the same people do the same things for other areas. So when you go to meetings for this, it's the same people that are at meetings for other things. So there is a lot of collaboration, but unfortunately there's just not enough people getting involved. So I'd like some of the ideas that were talked about, like volunteer coordinator, those kinds of things. Spark the Change Colorado last year did include us in their RSVP program. The RSVP program, my understanding, was here a decade plus ago. They will be coming back to our area. So, but they are addressing food insecurities. So Karen Share has been a wonderful, wonderful partner. They brought in 600,000 pounds of food last year. I felt like we were doing a distribution every year. We had State Patrol there. We had American Legion there. So like we, you know, so all these people are really coming to the table. So I think, you know, with COVID, we've gotten a lot more money. We're able to do a lot more things. And the AAA Director Network is a wonderful network. We have all 16 of us have our own nonprofit. We're C4A. And I think Lyle mentioned about the CASOAs. You know, all of the CASOAs, they're all there for the whole state. So we felt as directors, like we want to know what's going on in the state. We don't want to have to go to 16 different areas to try to figure it out. So we've really kind of brought that all together. I think it's c4a-colorado.org has all of that there. And, you know, so as a unit, like we are really working together to do things across the state. We did a big project of what we did in Colorado. Through COVID, we were able to bounce ideas off each other, very innovative ideas, very, you know, we're definitely moving in the right direction. So what I feel we need is just more involvement. I honestly believe that a lot of these seniors do want to volunteer. They just don't know where to go. They just don't know how to get it started. So hearing a lot of the ideas that were shared today, I know the direction we need to go. I do have a local senior that is working on a creative aging is conscious aging. And she's kind of been going around and I've been partnering with her. We've just hired a new person who's going to kind of take that role and move her project forward. So we're doing good things. Like I said, those, you know, local governments, they're listening to us, they're hearing us. My department, Area Agency on Aging, I'm the only full-time employee and I have about 10 part-time employees. And we do all of the AAA services, ombudsman, meals. We don't have providers that do meals. We don't have Silver Key. We don't have Volunteers of America. We do those ourselves. So those are actually AAA employees that are putting those out there. We do direct services. And even our in-home care is our agency that does those services. Our transportation is our agency that does those services. So we see a lot of challenges with transportation and we're working on those. They are expanding bus staying finally down to this part of the state. So it will be interesting to see how that impacts us. And I also am the administrator of the CSBG grant in this area, which is a low income grant. And because most of our population, or a majority of our population is seniors, you know, it applies to them as well. So we're trying to figure out how we can leverage those dollars as well. In the past, we've had to use it to supplement AAA because we weren't getting enough, but now it's kind of expanding. So I think we have a lot of good things that will be going forward. So that's kind of it in a nutshell.
Oh, thanks so much, Veronica. When I talked to Veronica earlier this week, she said, I have 5 minutes. I'm dashing out the door to deliver meals. So she truly is wearing almost every hat down there, but they're very lucky to have you, Veronica. So keep up the good work. Well, thank you to you all. Whether you recorded your presentation or shared it just a few minutes ago with us, hugely informative. And we've got some great questions that are coming into the chat room. I've got some as well. So encourage, though, folks, the attendees to put in some questions now that you've heard all the presentations. You may have a specific question to one of the panelists, and we can take a deeper dive in the about 20 minutes or so that we've got for Q&A. A few of you mentioned intergenerational programs. I know Sue, so Lori, I know you're speaking on behalf of Sue. Eden, I think you had a tech program that involved some intergenerational programs. And this is open to everyone, so this isn't just limited to Lori and Eden by any means, but Can you talk a little bit more about how those get set up? What is the framework for those? They always sound good, but there's a lot of work behind the scenes to kind of connect, you know, those generations together. So if you both or anyone else can address that a little bit more, take us on a deeper dive into those intergenerational programs.
I can start through the partnership of age-friendly communities here in Larimer County. It was actually started as a high school project for one of our community members, high school student, and she partnered with CSU, the Center for Public Deliberation. And so what we do is we put out into our community the topic that we will be talking about, and we used to do this in person, and now we're doing it all virtually, obviously. And so we'll break up into different rooms and discuss a certain topic, and then come back together, and we really just you know, where there are those things that are common between older adults and younger generation, which I find to be fascinating. We did one just for women, and we had women from ages 18 all the way to 90, and we had different breakout rooms, and it was just a really great experience just to see how women, you know, of all generations have been dealing with similar, you know, challenges throughout their life. That's one of our intergenerational. The other thing that we do too is that we work with our employer-based here in Larimer County, and we educate them on how powerful it is to have an intergenerational workforce. And so we do a lot of training in that area to our local businesses, just letting them know that the older adults really have expertise, experience, and how working with younger employees can really be empowerment to the whole organization. So those are a couple of intergenerational things that we do here in Larimer County.
Thank you, Lori. Eden, do you have anything to add with the tech program that was created?
The one thing that is interesting when you work with youth is that there's always there's a little bit of an extra layer. So we needed to have parental permission, which, you know, we didn't hit our radar right away because we're working with older adults, and suddenly here's this other piece. But I think, you know, I have in my agency two incredible programmers. One is a program manager and the other is a program coordinator. And Boulder Universal High reached out to us, and we discussed, you know, the implications, because sometimes these types of programs can be labor intensive. But once you set up the permissions and the groundwork, and you do some of the basic logistics, it takes on a life of its own. It just evolves. And as older adults talk to each other about how beneficial it was, and as the high school students talk to each other about how much they liked doing it, it developed, and it became a little bit of sort of a mentoring type of an issue, I think, in a lot of ways. And it's interesting because years and years ago, I worked with youth, and we set up something similar, but from the youth perspective. So it was really interesting to see this end of it and sort of come full circle. And so I think the deeper dive is just making sure you get all the, especially with tech, because it is, sometimes there's personal information and confidential information as that might come up. And so just make sure you have all the I's dotted and the T's crossed with documentation and permissions and waivers. And then those kind of programs they do blossom.
Yeah, terrific. And
Jody,
yeah, go ahead, please.
I just wanted, I kind of forgot that intergenerational piece. So our agency also has early learning centers, and one of them is right next door to our senior center. And pre-COVID, they would go over for holidays and have lunch with the seniors. And so these are little, you know, preschool age children. And then they would also make like Valentine's, Mother's Day, Christmas cards, those types of things. And we send those out with meals. So seniors were really excited to get like those different holiday things, but they really liked when they came over for picnics and visited and those kinds of things. So we did them with the younger stuff. I would love to do something with the older teenagers.
Absolutely, absolutely. Before we leave the intergenerational discussion, anyone doing that type of work outside of your community? So have you reached into bordering communities or other communities across the state to engage in any of this type of intergenerational work? Is anyone doing? Because that's interesting. Phil in the chat room has said, as the state is looking to use, federal dollars for various programs, what can we do that's more statewide? So kind of leave that with certainly all of you. Here at CU Anschutz, we actually have a social isolation program where we're pairing CU Anschutz students, future healthcare clinicians, and an older adult in a phone program. And that has just blossomed across the state. So it's fantastic to have students talking with older adults in Grand Junction or Fruita or Montrose or, so it's a very small example, but as we kind of all think about this intergenerational programming, there might be opportunities for us all to work together to take this more statewide. So kind of along those same lines, but moving to another hot area that we actually addressed the first week of our webinar series, and that's really workforce development. So talking about what sort of workforce development for older adults, what are the opportunities in your community that are happening for that particular demographic? And I open that up really to all of the panelists to share.
Well, I can briefly touch on that. We work very closely with Workforce Boulder County. And prior to the pandemic, what we had been doing, which I think is a great idea actually, is every couple of years, we would hold a job fair, a 55+ job fair specifically for that group. And we looked primarily for employers who had taken the AARP pledge to hire older adults. And we had, as you would normally think of it, a very large setting for a job fair. But then we had specific workshops, and we had brush up your resume and other types of how to do a good interview and other types of little specific things that people could sign up for. And it has been very successful. And the reality is many older adults are continuing to need to work, even in retirement, some part-time work, or they're looking for maybe a different type of job experience. And so I think that our job fair experience has been really good. We worked with our local chamber of commerce and partnered with some other agencies, and that I just think it was really successful. And so I'm looking forward to getting back to doing that again now that we are moving more out of some of the restrictions from the pandemic.
Terrific. Anyone else have anything going on in their communities that highlights workforce development for older adults?
I don't have anything to add specifically to that, but I happened to be in a webinar with Pinnacle Insurance last week, and they quoted a State Office of Demography statistic that by 2030, 1 in 5 employees, and I'm sorry, I can't remember if it was 60 or 65 and older by 2030 in Colorado. And that really struck me. I just thought that would be worth noting.
Absolutely. And when we put together our Value of Older Coloradans document through Colorado Senior Lobby, now Colorado Center on Aging for Aging, 71.8 years is the retirement age of older Coloradans. So we typically think, 65, 68, but we're much higher than the national average. So people here want or need to work well into older age. So it behooves us as a state to ensure that those opportunities are created for them. Definitely. Anyone else with regards, before we leave the workforce development discussion point? All right, so the next question that we have is about engaging communities of LGBTQ or Black and Indigenous populations. And Bob, this is actually for you. Jennifer has a specific question about Colorado Springs, and are they doing any type of work around programming for these populations?
No, I'm not familiar with it, so I can't really comment on that.
Okay, that's fine. How about let's open it up to any of the other communities so we can, this is an opportunity to learn from each other. Is there any specific programming initiatives that involve this area?
Hi, good afternoon, Jody. This is Malia Glapion, the Director of Policy and Advocacy at the Center for African American Health.
Thank you, Malia. Yes, please jump in.
Hi, how are you doing? So I just wanted to chime in and say also in the piece for the workforce development for aging Coloradans, we do have several programs undergoing and that we've been revamping, of course, per the state of affairs with COVID-19, as others have already mentioned. And yes, we're aggressively working on that. I'm on the policy and advocacy side, so that is with our programming area. And the programming director, Yolanda Greer, her team works on that. And I've been in connection and connecting her also with, it was Equity in Aging, a conference that a few of us have attended regionally. And Amy, I don't want to butcher her last name, Amy Delpo with Denver Public Library. So really making connections and networks, which we want to see and utilize, especially here in the Northeast Denver area with Black and African Americans in the aging demographics. So we're just revamping a lot of things, but still working on a lot of programs that we already have in place. And also working with you. So that's been wonderful and great. And also working with others. And I don't want to pronunciate Andrea's last name, Kusaki, with the Colorado Senior Lobby. So a lot of work, a lot of action being made, and they're making action by effectuating those changes by their programs and holding those programs. And what we were discussing and looking into with Denver Public Library is our neighboring library here in Northeast Denver, having some of those workforce development pieces, and especially addressing the digital divide issue with our community, and how we can help and provide them with those tools so they can do their jobs. And yes, since everyone's aging and working longer into the workforce, we are really focusing on that because that has been a big issue identified.
Oh, Malia, thank you so much. And if you have any resources at all, or a website or anything that people can use as a resource, please put it in the chat room.
Absolutely, I will.
Yeah, this is a great opportunity for all of us to put any of the resources about some of the topics we're addressing today. If you have specific links or information, please add those to the chat room so that we can learn from each other. Lyle, there was there was a lot of interest in the volunteer coordinator position that's being funded by Next 50, and you had mentioned that there's 2-year funding for that. What does the sustainability of a position like that look like beyond the 2 years? And how can folks who do receive grant funding, but then obviously that runs out at some point, how do we ensure that these important positions for this volunteer recruitment and engagement in the community continues well beyond the grant funding? Can you share with us a little bit about what's the strategy moving forward?
Yes, what we put in the grant application with Next 50 is that it would be so wildly successful that the organizations themselves for which the volunteers are being recruited would be interested in continuing to fund that position. So United Way would continue to host the position and employ the position, but that we would ask the organizations themselves to contribute to the cost of the position. And the proof will be if it actually is successful. And if it is, then I can see, we need to be in front of that and make the ask early. And we have mentioned that more than once in the groups or in the group when we have brought up this position, that's a possibility. But yeah, that's something that we're going to have to work towards with 60 Plus Ride, Janet, and Meals on Wheels, and the other organizations that the recruiter is recruiting for, and we'll see if there's interest in that moving forward. I think another possibility is United Way. Since we are a fundraiser, it may be that we're able to contribute some towards that position. I don't think we could do it forever, but contribute some towards that position, so it's not a steep cliff from Next 50 to the organizations themselves, but maybe be able to soften the ownership of the funding of the position by the community itself over time.
Yeah, terrific.
I just thought maybe I would add that, again, COVID got in the way. So this was launched in the middle of COVID. And of course, a big piece of that recruiter's position was to go out and make inroads, make connections, make contacts, and give presentations. There's also a big digital marketing component to it. But so that's another piece that may delay, but so far I have to say, and I just got a brand new volunteer coordinator, an outreach coordinator at 60 Plus Ride, and she's been amazed at the volunteers coming in through the United Way effort, because we have our own effort, digital marketing effort funded through Daniel's fund. That's synergistic going alongside of this. It just happened that way. Ours was up first and then we got this going, but we're very pleased because it's a tough go. And so when you can find something that works for recruiting volunteers, especially down into the younger demographics, in age groups, it's pretty fun.
Yeah, absolutely. Great. Thank you for sharing that, because that's a struggle, I think, for most of us, that, funding runs out. Now, what do we do? How do we sustain this great work? So thank you for sharing that insight. We've got a few more minutes together, and I want to kind of change directions a little bit. And John, out on our western slope, you have a robust operation out there. You named off a number of initiatives, programs, opportunities that is happening on the western slope. Last week during our webinar series, we had representatives from ARP, Booberbond, talking about really how to use assessment tools to make our communities more age-friendly. John, was anything used out on the western slope from certainly, those organizations, or how did you assess what was needed in the community to come up with that long list that you shared with us?
Well, to begin with, the city of Fruita did create its own study, and the needs from that became very, very evident. And based upon the 8 domains of ARP's designated livable communities, we were able to abstract from those domains exactly what we needed based upon the study that was done for the city of Fruita. So it was just a very helpful assessment. And the assessing process was very comprehensive, because it involved all age groups, all ethnic groups, including minorities. And so we felt that we were very comfortable in using the data.
Terrific. Is that something, John, that can be shared if people are interested in learning a little bit more about what was included in that assessment, or how to build that type of assessment?
I'm sure it's just simply a matter of contacting Mike Bennett, who is the city manager for the city of Fruita, and I'm sure he would be willing to share that with anyone who requested it.
Terrific. Oh, thank you. Tell Mike thank you for that as well. Anyone else use any type of assessment tool to kind of build these your livable communities, your age-friendly communities? Did anything happen in the areas that you all represent?
Hey, Jody.
Yeah.
So awards, are we getting close?
Yeah, this is the last question.
Okay, thank you. Bye.
Any thoughts about assessments? Just giving folks a direction of some framework to use when, starting new programs, looking at age-friendly communities. All right, well, we've got some assessment work to do across the state then, and we can learn a lot from John and Mike Bennett. So, well, thank you so much. There were great questions in the chat room. I think we got to most of them, not quite all of them. A big thank you to all of our panelists for being here today and for sharing a little insight of what's going on in your little part of Colorado. The purpose of these webinars is to learn from each other. And we definitely did that today. There are a few resources in the chat room, so make sure before you leave today that you click on a few of those so that you can save them and use for your work. So with that, I would like to hand it back over to Bob Brocker. Thank you very much.
And Bob, this is Kelly. I'm just pleased to let you know that 4 of our 6 awardees are now on the webinar, and so are Rich and Jeanette.
Okay, great. Well, then I will just turn this over to Rich and Jeanette.
Jeanette, do you want to try doing yours? Because I know you had some concern about getting back to a committee hearing. This is how things go during the legislative session, folks.
Yeah, for sure. Hey, let you know exactly who's on the line or on the meeting. We have Senator Danielson and her aide, Kaylee. We have Christina Willis, aide for Senator Janelle. And we have Jared Hughes and Rachel Hurley.
Okay. Well, how about Jeanette, if you want, you're here?
I am. Can you hear me?
Yep. Why don't you start with Senator Janelle?
Well, thank you. And I don't know if you're going to share the PowerPoint or not, but we'd like to be able to present Senator Joanne Janelle the Public Service Appreciation Award from the Colorado Center for Aging, formerly Colorado Senior Lobby. And we really want to provide this to her because, we really appreciate and applaud her efforts that she consistently advocated for the many different issues of importance to older Coloradans. And we recognize that she has taken the extra effort to frequently remind her colleagues to remember about older people in their debates on the legislations. So there would be in committee, she would just stop and all of a sudden ask people, so where are the older adults in this group? Can you point to that? And are you making sure you are including them? And that has really brought the emphasis of older adults into each of the committees that she is assigned to. So we very much would like to present her with this award.
Thank you so much. I have a statement to read if that would be appropriate.
Absolutely.
Sure thing. All right. Well, thank you for having me today to serve in Senator Janelle's stead. My name is Christina Willis, and I'm her legislative aide. She sends her greetings and wishes she could be here today, but due to the current legislative schedule, as has been mentioned, she is not able to attend. On her behalf, I want to express her heartfelt gratitude to the Colorado Center for Aging for selecting her to receive this award. It is an immense honor. If you know Senator Janelle, you know that improving quality of life for seniors is a major passion and legislative focus of hers. Colorado has a significant aging population, one that is only expected to grow, and yet, as you know, seniors face challenges every day related to healthcare costs and accessibility, transportation, housing, and community engagement. This session, Senator Janelle has introduced bills to make prescription drugs more affordable, increase access to economical housing options, support decision-making for older adults and those with disabilities, and establish an alternative response pilot program to give human and social services more flexibility when working with at-risk adults. Some of these bills have already been signed into law, and it is the senator's hope that each of them will improve quality of life for seniors in its own way. But she knows that there is more to be done, and she is committed to working hard on behalf of our aging population and to serving all Coloradans of all ages. She knows that we want to live in a society where our seniors are taken care of. Everyone benefits from it, and it is, simply put, the right thing to do. Senator Janal would also like to recognize the important work that the Colorado Center for Aging does. Thank you for all of the amazing advocacy and education efforts that you make on behalf of older Coloradans. And thank you for honoring her with this award.
Thank you. All right. Okay. Rich, do you want to go next?
All right, I will call up Senator Danielson. Oh, and of course, my boss is calling me right now, but I'm going to turn him off to do this real quick. Senator Danielson, we're, and I know I'm particularly proud to offer you this Public Service Appreciation Award on behalf of the newly named Colorado Center for Aging, and I'll explain that to you later. But it's essentially the Colorado Senior Lobby, and for your many years now in the legislature as a preeminent advocate for Colorado's older adults, and working with us and other aging advocates, again, to advocate for older Coloradans. I think including carrying a very important bill a couple years ago to protect at-risk adults from abuse and abandonment and confinement, and carrying a bill this year that we think is going to pass to increase the number of medical providers with geriatric care specialties. And I think you have already ideas of what else to do next year. So we're very proud to be able to give you this award today.
Rich, did you want me to say anything?
If you would like to say a few words, you will have a minute to say so.
Okay, I'll keep it short. It's just an honor to be here with the Senior Lobby, the Center for Aging. Rich is right. We've partnered together for years, and my very first bill when I came into the legislature was on elder abuse to pick up where my predecessor had left off and move forward. We did pass several measures together to prevent the abuse of older Coloradans. And then Rich is right. Since then, we've also done a couple of things this year. We worked together on a bill to provide transportation for dialysis patients. Unfortunately, that one didn't come through this year, but we're going to pick it up first thing next year and get that, get that taken care of. And yes, our bill to increase medical providers for seniors is moving through the process, and I'm very confident that it will be signed by the governor soon. We're also working to try and fight and scrap for federal stimulus money to come to Colorado that, it's supposedly designated for those hit hardest by the pandemic. I don't know who was hit more hard than older Coloradans. So we're really working hard to get some relief funding our way to this community. And hopefully that can come through. And yeah, it's just been my privilege and my honor. And I'm so grateful for the award. It means so much to me to have this group, work next to me on all these measures. And it's really been my privilege to be here with you. So thanks to Bob and Rich, Jeanette, and the whole team. And I will say, every time there's a call to action and you answer it, it really, really makes a difference. So thank you for your dedication to this group, because your activism and your dedication, it really makes a difference when you demand of the legislature what's best for older Coloradans so that they can live independently and with dignity all across the state.
Thank you. Right.
Thank you again. All right. And now I'll turn it over to Bob.
Oh, okay.
Unless Mary, has Representative Young or her aide shown up?
They might be calling in. I'm not sure.
All right, well, we'll get them if and when they.
Hi, I'm Eiley. I'm Representative Young's aide.
Yeah, she called in.
Sorry
Right.
she wasn't able to join today.
All right, well, I think Jeanette, you were taking that as well.
Yes, well, I'm sorry, I'm sorry, who did you say your name is? I just didn't hear your name.
Yes, I'm Eiley.
Hi, Eileen. Well, please, we are very happy to also to give Representative Mary Young this award as well. And she has been an advocate for the older adults on many different areas. We recognize that she is just one of the few voices of the 100 that have genuinely care about the older adults. And we're very happy that she is able to support the older adults in legislature, to be able to advocate on their behalf and on our behalf, and to be able to partner with us as needed, so that we are all working together as one as we move forward in this. So we would like to give her this award in honor of her work with the older adults and from the Colorado Center for Aging or Colorado Senior Lobby. So thank you very much. Would you like to say a few words?
Yeah, thank you. And I wanted to express my apologies and Representative Young's apologies for her not being able to be here today, and she's stuck in committee. But she's very thankful for this award and for you all honoring her. She's really committed to working on issues around aging and committed to really supporting older adults in any way she can. So thank you so much.
You're welcome.
Thanks, Aileen.
Yes, thanks.
All right.
Okay.
Now we can turn it to Bob.
Okay, thank you. So our next award goes to Dr. Rachel Herlihy. And we would like to extend our thanks to you for your sorely needed, steady, and informed guidance and presence during the pandemic. This award acknowledges that your many long days and long nights have not gone unnoticed by older Coloradans. So Colorado Center for Aging applauds your efforts. And I hope that you have if you choose to, have an opportunity here to say a few words to us and introduce yourself to this group, many of whom have seen you on television, I'm sure.
Hi, everyone. Thank you so much for this honor. Rachel Herlihy, I'm the state epidemiologist for Colorado and our communicable disease branch chief, and I've been overseeing our public health or communicable disease response to COVID-19. So I'd love to say a few words. You know, as all of you know, it's been an incredibly challenging year for all of us, and it's been especially difficult for older Coloradans. This pandemic has brought too much grief and frustration, and it has really highlighted the challenges, tensions, divide, and inequities, where we really still have a lot of work to do. But really amid all of that struggle, I'm incredibly proud of what we have accomplished in Colorado through the work of state and local public health, healthcare providers, our policymakers, organizations like this, the Colorado Center for Aging, and probably most importantly, the everyday actions of Coloradans who have sacrificed so much. Our efforts have saved lives. Bear with me for a second. I'm going to do what I do and share some data. Colorado has tragically had about 6,500 deaths due to COVID, and that's obviously far too many. But if we had had the US experience in this pandemic, the average rate of deaths, that would have translated to about 10,300 deaths in Colorado. And that difference from the 6,500 deaths that we did have to the 10,300 deaths we could have had so far in the pandemic is 3,800 Coloradans who are alive today. And while it feels really awkward to feel proud that our tragedy has been less of a tragedy than it could have been, after everything we've been through, I think it's really important for all of us to recognize what we have accomplished. And that is what I tell my team. I try and tell myself that, you know, we really saved more lives in Colorado, and really all of us deserve recognition for that. Like most public servants and public health workers, I love what I do, but it has been hard, and I'm tired. But that's really what makes this recognition so meaningful for me. So thank you. It means so much to have my work and the work of my incredible teammates that surround me recognized.
I'm honored to serve as Colorado State epidemiologist, and I can't imagine being in a better place. Feeling the support from an organization like yours, from my leadership at CDPHE, from the governor's office has really made such a difference this year. Thank you for your trust. Thank you for looking to the data and science. Thank you for your partnership, and thank you for thinking of me for this honor.
Thank you very much, Doctor. Much appreciated. Okay. Next up, we have Mr. Jarrett Hughes. Jarrett is the governor's policy advisor on aging, and we want to thank Jarrett for his passionate devotion to the health and well-being of older Coloradans. We deeply appreciate your efforts to elevate the many contributions and the ongoing issues of aging in Colorado within our state government. So we applaud your efforts, and we'll give you an opportunity to speak as well. So Jarrett.
Thanks, Bob, and thanks everybody. You know, while I might be in the governor's office now, I used to be a paying member of the Colorado Senior Lobby, and I, very much think back to, in the grand scheme of things. I mean, I really learned so much from a lot of the folks on this call, whether or not that's Jeanette and Rich and Bob yourself, or Bob Epstein, or Ed Shackelford, or Christina and Diana, and just spending time at the Capitol, back in 2017, 2018, kind of learning the ins and outs of all this world. And so I really do owe a lot of, I think, my personal and professional development to this organization and this group. So I really can't say enough about the importance of kind of, intergenerational mentorship and just friendship and those opportunities that we have. And so I'm really grateful and appreciative for the recognition. I'm really proud to be doing the work. I mean, we have a lot to do, right? And we all know that. So, but it was kind of just one foot after the other, and keep on chugging along down at the Capitol and see what we can't do. So, really do appreciate it, and I do want to very much acknowledge Senators Danielson and Janal and Representative Young and Dr. Hurley for their work as well. And as I told Bob, I think a couple months ago, I think we owe Dr. Hurley and all of our public health officials like some statues or something built around the city or something. We'll work on that next. But it really has been quite a time navigating all of this, and I'm really proud to be a part of it. So thanks.
Okay, thank you, Jarrett. Okay, our next and last award goes to Kathleen Melendi. Kathleen, are you on here today? She may not be.
I know she wanted to be, but who knows? Since she's on, she's aide to the speaker, she may have been called away for something too. Who knows?
Very true. Well, anyway, I would like to, I'll just read this, and it's up on the screen now as well. So Kathleen is actually an advisor and executive assistant to the Speaker of the House, Alec Garnett. So this award is both an expression of our gratitude to Kathleen and her role as advisor to the House Speaker, and an extra mile recognition for her help in coordinating the House tribute for Colorado Senior Lobby this session. That was no mean feat. And we're very appreciative of the fact that occurred a couple of months ago on the House. We have the recording of that on our website, so if anybody would like to see it. So once again, we thank Kathleen for her work. And
Bob, this is Kelly. I just would like to share with the award recipients that these awards aren't just virtual. You're going to get an actual award delivered, probably in most cases, to your offices. So lest you think we just went virtual entirely, we actually have a bona fide award to give to you.
Yeah. The picture on the PowerPoint is pretty small, but it's there. So that's exactly what you're going to be getting. So thanks for that, Kelly. Jody, do you have anything else that you would like to say before we close this?
No, just on behalf of all of us at Colorado Center for Aging, a big thank you to all of our panelists over the last 3 weeks who have dedicated time and effort to prepare remarks, share their expertise, their insights with our audience. And this dialogue just contributes to, you know, making Colorado the best place to age well. And so we can't do this without all of you. It's certainly a collective effort, as many have said today. So a big thank you on behalf of all of us for making Older Coloradans Month so special, especially our first one out of the chute. And we look forward to many more educational opportunities with all of you in the future. Have a great summer.
And I would like to add too that we deeply appreciate the efforts of all of our volunteers. You saw a lot of those names flash up on the screen early on. You know, I won't try to name them all right now because I'll forget somebody. It's like the Academy Awards, you know. So but we deeply appreciate everybody's efforts, and because it takes a lot to put something like this together. It takes a lot of time and a lot of energy, and I also want to speak a little bit very shortly on behalf of the 2 million people in Colorado who are over the age of 50. And that number continues to grow as the average age of our legislators continues to grow younger. And so with a few very notable exceptions, our legislators are really not drawn naturally to thinking about the issues of aging, and who among us did when we were younger. So it's really our job as a group, and even our duty, I would say, to keep the issues of aging in front of them, to bring ideas for solutions, and then to advocate for those ideas. And if it's not us, I mean, who's going to do it? So if it's to be, it's up to me and you. So with that, I'll close the session, and again, I appreciate everybody's attendance today, and thank you all. Have a great rest of your week, and Memorial Day's coming up Monday. We can all picnic again. So have a great time.
And thank you to all the awardees.
Yes, much appreciated. Thank you for your work.
Yeah.
Okay, all right, take care, everyone.